It's Monday, March 10th. I'm Adam Walsh, and this is The Signal. There's a local group that wants to establish Newfoundland and Labrador as a global hub for healthcare innovation. But in this economy, you betcha. Today's show will dig into how that can happen, what's needed to make it happen, and why it matters to you. All right, so stick with me, folks, in this preamble. But maybe it's the news run or what I've been reading or watching in my spare time. But technology can be pretty dystopian at times, right? You know, worries about AI robot soldiers taking over. That's not what we're talking about today. The AI soldier robots will be a future show, hopefully way down the road. Today, it's nothing dystopian. It's actually looking at technology in a hopeful way. That's where we're focusing. And we're looking at this economy, the need to diversify, figure out a way around actual tariffs or the uncertainty of tariff threats, looking at Newfoundland and Labrador, the people here, the talent here, and what can be built, what can grow. So I've got just the guests here in the studio today to talk about it, and they're with a group called Nucleus. Mike Wesolowski is here. Stephen Ryan is here. Mandy Woodland. We'll go through your backgrounds in a second. Mike, do you want to kick us off with what Nucleus is? Because we've been prepping you for days on this.
Thanks, Adam. Happy to. So, Nucleus was born out of frustration a little bit. Mandy, Stephen, and I, we all run and have founded med tech companies. And we've all been trying to raise money to help scale and grow those companies and compete globally. One of the issues that we've found is it's very challenging to raise money for startups in Canada in general, but for medical companies specifically, it's next to near impossible, especially at the early stages. So Nucleus is building a community to found, grow, support med tech startups here in Newfoundland and across Canada.
And you're founder and CEO of Luxsonic. Tell folks about it.
So Luxsonic was really created to help radiologists better do their work. So radiology is critical to the healthcare system. Thousands of conditions, diseases, and traumas are diagnosed with radiology. Everybody has gotten an X-ray or an ultrasound, a CT, MRI at some point in their life, pretty much. So we are facing a crisis in radiology. The demand has just outpaced supply. And at Luxsonic, we've created software that helps radiologists be more productive, be able to do more work in the same amount of time, and ultimately get more patients through the health system.
Right, so helping folks, identifying issues, right, crisis, seeing issues, and saying, hey, wait, we can help with that. We can help streamline stuff, make it easier, and that can either save money, but also it gets people what they need in the system.
Absolutely.
Mandy, give us another. I always ask you this when you're in, but so CEO and founder of AMP Health, but talk to us about, because as I ask all three of you, and with your answers, I'm trying to create a mental image of folks for when we talk about the bigger healthcare innovation hub thing, because we're going to connect it all together. So go for it on yours.
Sure. So one person every 5 seconds dies from type 2 diabetes, and it costs the global healthcare system nearly $1 trillion yearly. And that's continuing to rise. And in Newfoundland and Labrador, we have a particularly disproportionate burden of diabetes. So that's why we founded AMP Health to focus on UN Sustainable Development Goals and to change this disease state where if you're diagnosed as pre-diabetic or at high risk, there's, for about 70% of people, a place where we can intervene and prevent that transition to type 2 diabetes. And so we're using data from continuous glucose monitors and our unique behavior change software to help people prevent developing the complications and further progressing with type 2 diabetes.
Excellent. All right, and Dr. Steve Ryan, what about yourself with PolyUnity? And again, people listening to the show, they definitely have an idea, like for Mandy and also for yourself, for PolyUnity. what you're about. Some new folks may not. So give us the elevator pitch or info on PolyUnity.
I'll give the elevator pitch, but I'll also self-reference the CBC if you want to get a really good deep dive on what we do. March 6th, there was a beautiful piece done. So on YouTube, if you tune in, and you can have a look at the March 6th episode. I went into very good detail on that one. So if this doesn't do it justice, you can tune in there.
Oh, and I will say to keep cross-referencing here, after today's show, some of today's show might make it up on video, and we're probably going to use some of that video to cover up when you're talking today.
Fantastic. Good editing. I know. So, I mean, PolyUnity, the mission is to give every hospital and healthcare worker access to the power of 3D printing. Yeah. And we're doing a good job of this, but slowly, right? And that's kind of the nature of what we're talking about today. Kind of got its legs and importance and field testing during the pandemic, which was kind of a response to emergency situations, and we created some PPE and regionally manufactured things for the healthcare system. And kind of time after time after time now, we've seen things like the Suez Canal gets blocked a couple of years ago, and global shipping can't happen as well. And now we're kind of emerging into another unprecedented time, which is a trade war with the U.S. And it's just another instance where the global movement of goods in the traditional way of things isn't working quite as it used to. So the importance of kind of regionalized, distributed access to advanced manufacturing infrastructure is going to be really important moving forward, especially as an isolated little island like Newfoundland and the broader Labrador.
So then when I started the show talking about a global hub for healthcare innovation, everyone's just heard what you're all about, and I think they can start to imagine like what other companies might be like, right? But what does that mean? Like, what does that actually mean for us in Newfoundland and Labrador if we turn this place into a global hub of healthcare innovation? Who wants to start?
I love that everyone's looking at me. Absolutely no. It's really exciting, and I think to reference what we've all mentioned, it's that we're based in a very small place, but we have a lot of opportunity here to be first and be innovative. So when we look at kind of what the government of Newfoundland and Labrador has invested in the biotech, health tech action plan, and what the plan is for the province, what we've seen from NLHS and the Innovation Lab, and then when we look to other provinces, other countries, in how they've focused on kind of what can they do best and how can they bring highly qualified people, grow their economy, that's really our focus, to say we can do this best because we have access, we have a small but well-connected ecosystem, and we can bring people here to test and trial and integrate their innovations into our system and be the world leader.
So to do that, well, who wants to jump on what Mandy's saying? I heard some breaths.
Yeah, I'd love to jump in on that just a little bit. I think first and foremost, if what Mandy's vision becomes a reality, we're helping improve the health and well-being of patients across Newfoundland and Labrador as a starting point. What that means, though, is we can take those same innovations, build them here, and scale them and grow them and export them globally, so that we're not just improving the health and well-being of Newfoundlanders and Labradorians, we're doing that across the world, and we can do that from here. And that's what it would take to be a global hub.
Go ahead.
2 additional points. One is like challenge breeds innovation. And we have been, navigating difficult conditions for a long time in Newfoundland and Labrador, having worked in healthcare for many years. I mean, you see how this picture has changed and is getting more and more difficult to deliver the same quality of care over Newfoundland and Labrador's vast geography.
Yeah, I mean, you just Google any news, type in, or actually just live your life in this province, and you are very familiar with exactly what you're talking about on a number of levels. Plus, then there's an urban-rural divide and other complications, you name it. Sure.
And this is, to Mandy's point, an opportunity, because we're still doing it and we're still here, and there's an opportunity to identify massive challenges, but turn these into solutions. And we're not the only ones in the world that feel this, right? So that's where Mike is talking about the exportability of solutions. So you create something unique and novel, and it works here. Then you have the fuel behind it to get it to the rest of the world, and that's massive. And that leads into sustainable industry. And I think this is another thing we're going to talk about here today, which is, Newfoundland and Labrador has traditionally been built on sustainable things, and we kind of jump from the hot thing to the hot thing to the hot thing. But tech has the ability to kind of span time and resource, right? And we can build this robustly so that it is something that is an engine for economic growth for Newfoundland and Labrador for the foreseeable future too.
Yeah, not something which as you're alluding to, right? And we just did a show at the end of February, I think it was the 27th, on the resource curse, right? So you're looking at, first it was fish here, then with oil and gas, we're talking minerals, but all the extraction stuff, and yes, very helpful over the years, right, for the economy and for jobs and everything else. But this, you'll remove by having this type of an industry. You're not having these big ups and downs anymore. It's a knowledge economy based, which is different than resource extraction. The thing we have alluded to and talked about a little bit on the show, right, the times we're in. Anytime you listen to a 5-minute news run, or you watch the National or the morning, or you just open your eyes at all anywhere, you're going to see, hear, or feel even tariff threats. So we're gonna talk about that briefly on the show, and I wanted a national picture on this because I think as well, if we're talking about creating a hub and turning into this global hub here, this time and space we're in is important to talk about. So Laurent Carbonneau is on the line, Director Policy and Research with the Council of Canadian Innovators. How you doing?
Hey, pretty good. Thanks for having me, Adam.
Oh, look, thanks for coming on the show. Okay, high level, here's a question I have. On the tech side of things, if I'm thinking like software and some of the tech companies that either we have in Newfoundland and Labrador or across the country, where are things at with these companies and these threats of tariffs? Is that even known yet? Like, how should tech companies be thinking when it comes to the current moment we're in right now?
Sure. So if you're on the software side, which a lot of companies are, there's kind of good news and bad news. The good news is right now, software is usually treated as a service, so it's not tariff. It used to be that when we would be shipping CDs and floppy disks across the border, then it used to be a good. But this is one of these things where economic changes have kind of insulated parts of the sector from that. Now, all of that said, that's great if you're just doing software. The reality is a lot of companies in the innovation economy have a lot of, complicated supply and value chains too that they're a part of, whether you're in the semiconductor industry or medical devices or, various other things, clean tech. You're often sourcing parts from abroad, and, we do have a really integrated economy with the U.S., obviously. So innovators on kind of that side of the world are definitely feeling a pinch right now. And it's more generally, tariffs or no tariffs. And of course, the picture on this has been very fluid over the last couple of months, really.
Fluid's a good word, yeah.
Yeah. Yeah, exactly. The uncertainty is killing us, right? Like really more than anything else, like more than the tariffs, it's this big uncertainty bomb that's kind of sitting over the head of the economy right now. And no one wants to invest. So if you're a company looking to grow, looking to expand right now, it's really, really hard, even though obviously there are some really good opportunities with all of this. The situation is quite difficult, even if, you're not actually going to be facing tariffs on the goods you're exporting. So it's very tricky.
So then the way forward, right, if you've got folks bracing for what's to come and also looking at, pushing forward with some kind of economic growth and plans for businesses, whether that's just trying to tread water or maybe even grow, right? Like my guest today for what they're talking about. What's the look nationally at the way through this for what we know so far?
Yeah, sure. So, short term, I think we are going to have to find some kind of solution here to the 800-pound elephant here. Well, that's a small elephant, I guess, 800-pound gorilla. But more in the medium term, I think this has been a bit of a wake-up call that, obviously, a generation or two ago, we had a very big debate on free trade and economic integration with the U.S., which turned out to be, a really good deal for lots of Canadians. But I think we're kind of seeing the cost of that down the road. It really has, affected our sovereignty and our ability to kind of be a self-determining country economically. So I think we're going to start to see some moves to, buy insurance with the idea that, the first best solution for lots of Canadians, which is that we have a really strong north-south, coast to coast to coast economy, pretty integrated with that of the U.S. It's just not really on the table anymore on a sort of basis that Canadians can live with, right? Like it used to be, it was a partnership of equals, even if one of the equals is much larger than the other. Now it's a much more explicitly, and frankly, nakedly colonial attitude that the U.S. is taking. And we have no guarantee that won't come back, even if this current crisis gets resolved. So we have to be looking at other trade partners, whether that's Asia or Europe. Latin America, obviously huge. Africa in the next generation is going to grow a lot economically. And I think that will be very destabilizing in kind of the short to medium term, but I think it's a huge opportunity. I think, you hear a lot from people who've spent a lot of time in business in Canada, and, there's a sort of sense that it's almost too easy to go do business in the U.S., and that I think having that exposure to more global markets might be a really good thing for really making us a more entrepreneurial country that is able to kind of export, really widely across the globe instead of kind of settling for this very big and very rich, but very close market that perhaps we are not thinking broadly enough.
And Laurent, before I let you go, I'm just thinking about procurement, right? When it comes to for example, if I look at Adam Walsh's individual buying power, not a whole lot. But if I'm the provincial government for Newfoundland and Labrador or the federal government, there's a lot of procurement power there. What do you think what are folks either talking about, or what should they be thinking about when it comes to procurement and the way forward?
Yeah, procurement, huge opportunity. I think this has to be part of the playbook. If you look at kind of procurement across all levels of government across the country, it's 15% of our economy, which is about as big as Alberta's economy or the natural resources sector across the country. So it's really, really big. The problem is it doesn't work well, right? So, I think you've heard a little bit today from folks on this. But the amount of hoops people are jumping through is just, frankly, pretty ridiculous. It's a system based around, checking the boxes instead of making sure the results are good. So there's a lot of reform ideas out there. CCI, my organization, did 2 reports last year on sort of public procurement of innovation. What we need to do is make the system a bit more lightweight for sure, but change the risk calculus, right? Fundamentally, like public servants right now, and they want to do a good job and they want to buy stuff that works. But right now the system is basically saying there's no risk to the status quo, right? But the reality, you look across at stuff at the federal government, like the Phoenix Pay system, it's just not true that doing things the traditional way has no risks, right? Like they do, they fail all the time. So I think we need to take a bit of a more entrepreneurial approach. There are some programs across the world that have been quite successful in doing this. The American Small Business Innovation Research System is really, really good. We look at programs from Finland and the UK as well. That are helping public servants sort of trial things and buy them much more efficiently, kind of from innovative perspectives that don't lend themselves well to traditional procurement where you have to have all of the sort of nuts and bolts laid out completely in advance. There's no scope for experimentation or learning by doing. So, these are kinds of things where we want to see some progress, and we've laid out some options for governments. The other piece, too, is, this is kind of a more ambitious thing, but looking at how we can kind of integrate our procurement market, right? We've talked a lot about interprovincial trade barriers, and I think that's a really worthwhile and good conversation. But obviously a really big one here is that governments they don't have the same buying processes, right? So if we made those processes look a lot more similar across the country, you'd see a lot more competitive market in procurement, which I think would, only be to the good considering the size of that market.
Laurent, folks, anything for Laurent before I let him go?
No, that's well fleshed out.
Yeah, lots of great stuff. It's almost like it was your professional job to talk about this stuff all the time. Laurent, thank you so much.
Of course. Always great to chat with folks out on the East Coast. So have a good one.
All right, you too. Laurent Carbonneau, their Director of Policy and Research, Council of Canadian Innovators. All right, what do we want to, lots there. That could be, I could have you back tomorrow for a whole other show to unpack everything, but we don't have that time. Thoughts on what Laurent was saying?
I have one knee jerk to it, which is, anything that we choose to do right now has to be sustainable. That's the biggest thing. I think we had a lot of knee jerk reaction, flash in the pan kind of policy changes and things like this that we observed during the pandemic, and very quickly afterwards went back to normal. Right? All the red tape came back up, and all of the free collaborative kind of feelings that happened during that time, and support for innovation and purchasing power and things like this. All of it had a moment in the sunlight during the pandemic, which is interesting as a silver lining. But again, a year to a year and a half afterwards, it got sticky and slow again. And I just hope that in response to this situation, we take a lesson from the past and build a sustainable version of this thing that lasts.
Yeah, and if the U.S. opens up all of a sudden, change and whatever.
Sure.
But to remember, hey, this moment, and to kind of keep pushing stuff.
Keep the game going.
We don't want to go backwards.
No.
Yeah, we want to keep moving forwards with changing how certain processes work, I think.
Anything else that Laurent said that stood out?
I think the focus on kind of removing interprovincial barriers is really important, and also finding opportunities for people to source within the country.
Yep.
So I was in Toronto last week for the Women's Innovation Summit held at DMC at Toronto Metropolitan University. And while I was there, the timing was great. They launched this O Canada, which is a tech directory. So for governments, organizations that source software or technology outside of Canada, it's a really great directory where they can find Canadian-built software and tech products to, again, focus on that sustainability, keeping money within the country, and find alternatives that are going to be sustainable long-term and help us move forward as opposed to backwards.
Oh, that sounds fantastic, because that's one of the things that came up on one of the previous tariff-type shows, which we're doing. I mean, I think Jacqueline Lee was on that one, your CEO, right? Like, we were talking about the fact that people need to know who is where and what they're doing in order to then be able to make the decision to source locally, buy locally, and whatever else. Because the example on the show, I think, was there was a trade, some kind of a group went somewhere to like overseas, and people on the Team NL team, some of them just kind of, oh, I didn't know you did that. Oh, I didn't know you did that. Well, we should get together and talk about that. It's like it shouldn't take trade mission in order to get folks together to talk about and understand who does what for the purposes of the way forward. You're listening to The Signal. I'm Adam Walsh. If you've got, yes, I mean, today it's a tech show. It's a healthcare innovation show. We're talking to folks with Nucleus and, their idea, what they're trying to make happen is to set Newfoundland and Labrador up as a global hub for healthcare innovation. If you have thoughts for us on today's show, The Signal at cbc.ca, you can call the Signal line and leave a message, 709-576-5260, or you can text us, 709-327-8206. So we've covered pandemic pivot in a way, right, and looked at what happened there to now. What are the roadblocks are you folks facing? Because you talked about red tape of being gone and back again. So what are some of the other roadblocks right now to establishing this hub that we're talking about?
Well, I mean, first off, as I mentioned in the intro, funding.
Yeah.
So not just for our companies. So in general, funding, private funding for med tech is sparse in Canada. And we need to build ground roots, community around angel investing, so the earliest stage of investing. But we also need dedicated private funds for later stage. Once you hit about Series A, which is a later stage company, there's funding there. But in those early stages, when you're trying to get established, when you're trying to build commercial traction, there's not a lot of funding available privately. Now, and I'll finish in a sec, but there's lots of government funding right now for R&D in Canada. But once you get past that R&D stage, for commercializing, scaling, growing your company, there's this desert of funding.
When we say angel investing, what does that mean?
So an accredited angel investor can be anyone who makes over $200,000 a year or has $1 million in net worth. So literally anyone who is in that bracket can invest in a private company. So instead of putting your money into the stock market, you can reinvest your money in local companies that are doing good, building here, growing the economy that way. Now, obviously, not everyone has $200,000. In fact, a lot of people don't. But we do have a large community in Newfoundland and Labrador that we're trying to reach out to and grow this angel investment community here.
There was the Newfoundland and Labrador Angel Network a number of years ago. That's been defunct for a long time now. And if you go to other provinces and areas, they have kind of robust angel network ecosystems of folks who get together, pool their money to invest in early stage companies. And so we'd love to see that get reestablished in Newfoundland and Labrador and give people the opportunity to look at how they can make an impact locally in a different way.
We talked about risk earlier too, just like riskiness. And investing in a company is risky, but investing was typically that, like this guaranteed return in 2 years or 3 years on your money. Like that's not really the case. We want to get a kind of a community and a feeling of importance of the company that you're investing in. And if you think it's doing good, has potential, you can contribute and collaborate with them and help them get to where they're going to go. It's more of a mission and vision-based investment, right, than it is just a guaranteed ROI. And that's the kind of people we're trying to draw out, I think, that really have a passion for it and want to see something grow that they're interested in.
So do you guys have events coming up when it comes to angel investing? And like, how do you go about trying to attract, like, because you talk on the radio, but I don't know how many angel investors listen to the signal. I mean, I would like to think it's a bunch, but who knows? So how do you get them to pay attention and to think, you know what, this is for me or us?
Yeah, so we hosted our first event last month in February and had a lot of interest and a really great turnout from some folks who have angel invested in the past, a lot of folks who have never angel invested but have the capacity to do so and weren't aware of those opportunities. And I think that's really the key, is just really doing kind of at a ground level, reaching out individually to people, spreading the word through word of mouth, and bringing in folks who can bring in their friends and other people. I think that is really important to grow a bit organically with this and make sure it's sustainable. You can tell that's our favorite word, whether it's our companies or the ecosystem or the investment lens. But when we look at like Women's Equity Lab or angel, investment networks, they're all doing really cool things, and we want to give people more opportunities to do that. That helps on both sides. Mike mentioned earlier the bigger challenge in medtech or health tech than in other kinds of technology, and it's because it's often a much longer path to revenue and commercialization. So that difference in patient investment, so folks who get healthcare or folks who understand the amount of time that takes, whether it's regulatory hurdles or procurement hurdles, it's a very different space.
The size of this place, shouldn't that be a strength then when it comes to talking and meeting angel investors and get everyone in the room? Because I keep hearing this from tech crowd, right? I'll have folks, not you folks, but other folks in talking about, hey, the strength is how small we are and everything else about you can pick up a phone, talk to anyone. So then, okay, sure. But now we've got this thing of, well, we're not getting as many angel investors as we want. Like, why is it taking a bit more time to make those connections?
Well, I think we're just starting, really.
Yeah.
And as Mandy said, our first event was fantastic.
Yeah.
We had a great crowd come out. Now it's just getting the word of mouth out there and to do some education. I think most people who could angel invest don't know much about it. And I think if people start to realize that you can support local companies and you can get there's risk, as Steve was saying, but there's also a large reward. By investing in a company early, the reward that you can get if they exit, for example, through IPO or a merger and acquisition is huge. It can be a much larger reward for the individual investor than you could get on the stock market. But at the same time, when you're investing in local businesses, you're growing the community, you're growing the industry, and you're helping to support Newfoundland and Labrador as a whole.
And this is just a new and fandangled buy local campaign, right? It's like you could invest your money anywhere. You could put it into a company in the United States. You could send it overseas somewhere. But again, this is just one of those moments in time where maybe if you had a little bit of extra, you're going to buy from the urban market and you're going to go and have coffee at a local coffee shop. Like you can invest in med tech companies that are solving enormous problems here as well, which is so cool. And back to the event really quickly, I'm going to toot Mike's horn because He's a fantastic public speaker, and the events are very simple, like that we have tried to kind of arrange here, which is more of just a small scale networking event to have people meet each other and see what their interests are, but then also have really targeted and impactful exposure to local med tech companies. So Mike was kind of the feature of our first one, and he did his pitch, which is, if you haven't seen it, it's amazing. Come to the next one. But we got feedback immediately afterwards, which were, these people went, that may have been the most interesting thing that I've been to in St. John's in a long time, right? Like, that's cool feedback.
Yeah.
Right. Just to learn about the companies and what they're doing, and then if that sparks interest from an investing perspective, you have the opportunity to follow up with the companies.
So then, if we're thinking about, okay, you got an event, you're trying to get angel investors, and let's say you get them, and then keep building the picture down the road as it's not just one company, but it's companies, and as we're building out this hub, like for folks listening, what would this mean for them or the province or either the provincial coffers or St. John's Metro or the whole province altogether?
Yeah, so I think any investment in local organizations creates jobs. It creates a broader tax base. It contributes to supporting our very expensive healthcare system and creating better infrastructure. So we've seen it in other places where as these ecosystems grow, the community grows. And so there's opportunities to have better public transit. There's opportunities to have better schools and more teachers and more sustainable food, and all of those trickle-out effects of investing in that. And that's why we've seen other communities hard recruit companies like ours to move there because they want those opportunities themselves.
When we say hard recruit, what are other parts of this country doing to get companies like yours to move there?
I'll give you one example from last week, which was a community in Ontario that's offering medtech companies $500,000 to move to their city, including helping support their families find jobs and their kids find activities, because they know that the impact of having this kind of hub in their city is huge.
That sounds like a hard recruit, right?
That's a hard
By definition.
recruit.
Yeah.
Here's $500,000. Well, what's my spouse going to do? What about my kids? No. We will help you.
We'll figure it
worry
out.
about that. Yeah.
So then, what in Toronto? When you're talking about this spot in Ontario with this hard recruit, what's the buzz then from others in med tech when you're hearing this? What like when people hear it? What do they say? Like, is it like? And what was your response, or for the rest of you?
Yeah, I'll give you a little bit about the buzz, and then you guys can respond to your response. But I think we're seeing it from a number of places right now. So we've seen it in some cities in the U.S. We've seen it through Asia and through Europe, that places that have focused on building their ecosystem and recruiting companies really want to make that happen. So for companies like ours, the buzz is, where's the best place? Obviously, we want to be here or we wouldn't be here. Yeah. There's a lot of challenge to being on an island in the middle of the North Atlantic. So it's hard decisions of money versus long-term investment versus like wanting to be surrounded by family or to support this place. So it's really, the buzz is, this is a hard choice. How do I decide where my company will grow best, where my family will best thrive, and then make the decision from there?
Any other thoughts there?
I think it's also looking for path to market, right? And if that is a sustainable amount of money for an early stage startup who are bootstrapping and trying to figure things out, that's like literally game-changing amounts of money that can get you from a prototype to an MVP into a hospital, right? Like that can get you there. We've seen over the last maybe 10 years or so, a lot of Canadian med tech companies in particular will just kind of jump to the United States right away, right? And we've heard time and time again, why are you tackling the Canadian marketplace? Why? Like, and that's from investors, that's from VCs, that's from potential, other hospital players, and they just say, go there. It's a bigger market. You'll get to your revenue targets quicker, et cetera, et cetera. And I think, again, this is an introspective moment where you got to say, well, why am I building this thing? And to deploy it in somewhere like the United States with a completely fundamentally different healthcare system, to be able to bring it back and retrofit it then to Canada once you're done scaling and getting it all fine-tuned for the marketplace, that's kind of working in reverse to me. And I think the whole idea here is that Canada can be a very, very fertile and amazing place to scale medtech, and it's big enough that we can do so and get a big enough market capture because we don't have a ton of companies and there's only so many hospitals. So you can do a good job of getting the whole marketplace. And
I mean, there's a bigger, and not necessarily for right now, but like there's a bigger sovereignty discussion too. In a time when there's threats of annexation, having local companies that do things locally for healthcare and everything else, it's important.
Agree.
Absolutely.
But then for Newfoundland and Labrador, have we seen like with these hard pitches, sells, recruitment efforts? Have we seen companies? You don't like to say if we like name them or anything, but like, have we seen folks move? Like, or like, are there companies moving out of here? Like, is there the wish to go to Southern Ontario or British Columbia? Like, have you been in those conversations with people? Like, you know what, I wouldn't mind $500,000 and help with my family relocating.
Yeah, I think, well, we've definitely seen companies leave Atlantic Canada for, the mainland or for the U.S. Yeah. We've definitely seen some from here go to the U.S. I think the Verifin example has done a really good job of proving, at least on the software side, that you can build from here and have global massive success. So people will still look to that as why you can stay here and do it.
Help change the narrative, right?
Yeah. But it's definitely a bigger challenge. And so if you can't access that level of private funding here and someone's offering it to you, I've also seen companies who've been offered that here locally to say, we'll give you $500,000, $1 million investment, but you have to move to the U.S., turn it down, and say, we'll figure it out and we'll stay here. And so it's a hard choice because your company could die while you're waiting to get to that next step. But I think we're going to see more of that if we don't do more to encourage and support that early stage growth.
So then what should be done to encourage and support early stage growth here?
Well, I do think, being able to create this ecosystem and grow the ecosystem from the early stage angel investment to later stage investors, but also we talked about procurement earlier, to smooth the pathways for procurement here so that we can use Newfoundland and Labrador more as a test bed and as our first customer. If you can start a company here and go from a prototype to your first customer, that increases the value of your company dramatically.
Yeah, because it makes you're real.
Yeah,
right.
Exactly.
It's like, I can see this. They've got a customer.
And so building that pathway really is part of our goal, but it's also the goal of the government. We've seen a huge push for innovation in healthcare in Newfoundland and Labrador. I think we can continue to improve on that, but this is a good place to start a company, scale a company, and get to your first client.
Two things was what kind of incentives or hard things would make me move away, and also the point about a small scale place is what you brought up earlier. Yeah. And I think the hard stay for me is the small place and that connectivity at this point in time. I couldn't find that, I think, elsewhere, regardless of what the cash offering may be. Firsthand account of this is I believe actually Newfoundland and Labrador and Newfoundland and Labrador Health Services, their innovation hub, as well as the support from provincial government and even from the federal government level around this has been disproportionately good, relative to the rest of Canada. When I've gone to some conferences and you get up on a stage and people say, "Hold on, you started a company in Newfoundland and Labrador and you have a contract with your hospital and healthcare system." Yeah, how? That is the only question I get. How did you do that? And it's not me. It's with an enormous community effort put around that activity, which is make something robust and get it purchased. And that's coming from every level that I just talked about. So doing a really good job nationally, number one. Number two is absolutely room for improvement and growth. And I do think this thing is just getting started. Yeah.
Right. Well, then also earlier when we were talking about the pandemic and how that pandemic pivot thing happened, it's like, okay, we're going to make more here, we're going to do more stuff, and let's get rid of red tape. And then there was a point in time where red tape came back, it got more sticky, I think was what we were saying. How have the conversations changed again?
I'm going to take this one really quickly again because red tape is not a bad thing, right? Like
No, it's for safety for a lot of
especially in
reasons.
healthcare.
Totally.
and especially in
Yeah.
healthcare. And I just want to make sure we're talking about that the right way. Because red tape also comes in the way of regulation and it comes in the way of process and diligence. All that needs to be present. But there's red tape in terms of community collaboration, access to funding. It's all of these like softer things that are just hard for some reason that could be a little easier, right? And like again, from a regulatory perspective, keep your guardrails up, keep your tape in place because you have to check certain boxes to not only validate your product offering, but have some amount of validity and trustworthiness of the solution in the broader marketplace. And if you kind of skirt around that, you're not going to have a good product. So that's important. But we can make all of the other logistical things around that easier, in my opinion.
Yeah, and I think, just to echo what you're saying and to give you a specific example of some of the challenges, there's no budget line anywhere at NLHS for innovation procurement,
Yeah.
right? So just putting a budget line in would make it infinitely easier for us for NLHS to purchase products that are built here. So it's small changes to process and maybe thinking about things just slightly differently.
Mm-hmm. And this is where maybe we come in the future, right? Is identifying an angel network, working with government to maybe, match that pool of funding or something. That's when you get your first little cohort of companies in the system and start to fund them in a meaningful way so that they can become sustainable and hit the marketplace. But I think that early access to funding can come in a variety of ways. That can be an innovation fund. That can be from provincial and federal government. But I think also that investor base is really important. If you put all three of those things together, suddenly you have a pretty good launch pad, right?
So then is government listening right now when it comes to the possibility of having a budget line for innovation, right? In this time of we're looking at everything, buying Canadian, having the pitch, has that again changed from the pandemic stickiness of some stuff to is there an openness now for this type of a change and these changes?
Yeah, I think we've had a lot of really good support, like the guys have said, both provincially and federally on that. We're seeing it in private industry where people are putting in line items for innovation, for working with startups, for doing innovative procurement and pilots. And we need to see that publicly because we need the committed money for healthcare to stay in healthcare. And we need separate funds to be able to do innovation, particularly when, if we look at all of our solutions and all of the others in our ecosystem, they're actually all cost-saving products.
Yeah.
Right? So they significantly reduce the cost burden to the healthcare system, opening up funds to hire more healthcare providers and to provide better services.
So how does it feel to be working in your companies and doing what you're doing right now? Because there's even before the show, everyone always talks these days. We talk about stress, we talk about the United States, but then also with this conversation, there's a lot of hopefulness in what can be achieved and where you're heading, and what it could mean for Newfoundland and Labrador and everyone in it. So for each of you to be operating in this, it's not an unstressful time. It could be a very stressful time. And if you're in the tech sector anyways, I think for the folks I've spoken to, it always seems really stressful because you're just trying to, from bootstrapping your company to onward. What's it like in your lives to run this stuff?
Who wants to take that?
We're all delusionally optimistic. But also always very stressed. But I think that for me, it is exceptionally stressful. But what keeps me going is certainly this community of people. So we have other folks in similar and same boats, as well as those supports, right? I know I can call up Andy at Bounce or the folks at TechNL or this group of folks and get that support at any time. So, yep, super stressful, especially when we look at, okay, the U.S. was our primary market. Now, do we want to consider somewhere else? But I think it's balancing that with that delusional optimism.
Yeah. I think building a company from scratch is one of the hardest things that you can do in business, and it comes with a lot of risk, a lot of personal risk,
Sacrifice,
a lot of time, but ultimately, I think the reward is worth it. And in healthcare, we, I think, are all trying to, at the end of the day, help people with our technology. And that's the reward at the end of the day. Yeah, we want to scale our companies and we want to build these global enterprises and have the benefit of that. But the reality is we're trying to help people and make everyone's life better. So
I feel a bunch of like value out of action as well. And it's moments like these where uncertainty needs action. And it would be more stressful for me to sit on the sidelines, I think, at this point 100%. In time, right? Yeah. Than actually kind of just like dig the heels in and do the work and come up with some sustainable solutions.
So what types of things have you, because each of you are really different, obviously, but like what have you brought to the ecosystem here? Because when I look at something like the tech industry locally, everyone's got such fascinating backstories. And when you put all of that into like the tech industry stew, it makes it rather flavorful, right? Like so medical doctor, but what else have you, like, what do you think you bring into things with PolyUnity or the larger ecosystem?
Like different than others is it's not just software. Like we are manufacturing, right?
Yeah.
And that's kind of a different flavor to this, and kind of took a concept that was purely theory prior to the pandemic and deployed a regional manufacturing solution within weeks that solved the problem. And I know seeing that mobilization and this vision of what PolyUnity could be come into reality just set the stage for the next 5 years of our growth. And the lessons that we learned through the pandemic, then obviously we fine-tuned them, built a go-to-market strategy, validated the whole solution here locally with NLHS. And I think we're going to see the need for really nimble manufacturing in the near future. And this is with a lot of advanced technology with robotics and 3D printing and scan-to-print technologies and things like this. And I think if we're going to continue to weather storms here in Newfoundland and Labrador on this little island, we're going to have to get some manufacturing chops up too.
Yeah.
Yeah. So that's a cool angle.
That is really cool. Mike, what about yourself?
Yeah. So I think, through Luxsonic, I think we've built a really forward-thinking company. We're leveraging virtual reality and artificial intelligence together to bring on the next revolution in radiology workflow. So everyone, I think, has a picture in their mind of someone holding up an X-ray, a doctor holding up an X-ray. That's not how people do radiology anymore. That's not how radiologists review our scans. And, we've moved to digital, but our platform, I think, is the next evolution of that. And it allows us to connect remote and rural areas together in a way that they just can't be connected right now, to allow expertise to exist in urban centers, but connect with rural areas, connect with X-ray devices in Labrador, and provide real-time feedback. And so I think that in a lot of ways is going to add value across the province, not just in St. John's, but everywhere. So,
Mandy.
Yeah, I love the rural and remote comment because that's what's always in my head, that everything we're doing actually enables better access to care in rural and remote areas. I think that's a really important thing, and I think we all bring a really kind of random and diverse set of experiences with personally and with our companies to that stew. I was working late last night with a colleague at the Genesis Center, and there were a bunch of students there who are pitching at the Mel Woodward Cup.
Oh, cool.
And they are political science students, computer engineering students, business student. And so that really is what jumped in my mind when you asked that question, thinking people are bringing all these, and all of these students were immigrants to Newfoundland and Labrador, came here for memorials. So I love that that's what's being brought into this ecosystem and the importance of kind of bringing us forward in health innovation.
So then when you look at what you're building with Nucleus, right, and we've talked about your own individual companies and also just then for students and some of this inspiration for seeing them, when will you feel, hey, this is really moving, right? Like if it's for like 5 years from now, or is it 2, 3? Like what's the timelines? Like when it comes to this stuff, I don't have a concept of timelines, but I know you do. What are timelines for looking at for when it will be like, we're doing it. This is what we were hoping for, a global hub for health innovation.
Yeah, I think within the next 5 years, that's the timeline to really start moving things. Even this year, we've already started with our first event. I think those are going to grow. But our goal is to grow and build companies here, not just our own. So within the next 5 years, I'd love, success for me is 20 companies have been supported and are growing, building their technologies here, scaling here, and exporting technologies around the world. So I think that's a very achievable goal.
I think that plus that we're seeing companies from elsewhere want to come build and start and grow in Newfoundland and Labrador.
Yep.
Yeah, so getting folks setting up shop here.
Absolutely.
Success also comes in a bunch of ways, and even disseminating lessons learned through our trial and error and persistence and maybe ignorance and whatever through our pathways in medtech, even sharing those insights with other founders in the space would be, I think, massively beneficial to everybody too. And that's gratifying. That's rewarding as well. Set you up for success where maybe I didn't. Yeah.
Are folks wrapping their heads more around the tech industry when you talk to them locally? Like, because it's not new, right? But it's not the fishery. Mm-hmm. Right? Are you breaking through for understanding across Newfoundland and Labrador?
I think there's a spotlight put on it. I think it is working and it is breaking through. I mean, we have the co-innovation space just recently built. TechNL is living inside of that. Even the NLHS innovation team, like these are signs of growth.
Yeah,
right.
And understanding.
Yeah. And it just takes a little bit of pushing that boulder over the hill a little bit, right? It's a little bit of a struggle. Everybody's figuring out what they do, what their role is, how do we best work together and collaborate. But I think there's going to be an ecosystem that emerges out of all this that works very nicely.
Yeah, and I think thinking about tech as an industry is maybe the wrong way to do it. Tech supports every industry.
Yeah, right. I work in tech, right?
Like, right. Yep. The fishery, mining.
It's all tech.
Every one of our industries can be supported by tech. And so growing companies in all of these industries specifically is something that I'd love to see continue to grow. MedTech is our industry, but across traditional industries, we can leverage tech to improve all those industries as well. So, and we're seeing that.
Yeah, you're making me think of all the tech company type interviews I've done. I'm like, oh yeah, there's like the safety smart key folks for construction equipment. There's also like the not Uber, but like the other types of companies locally they've tried. Like it's just so vast, right? Yeah. It is so vast. Mandy, any thoughts from you for final thoughts, essentially?
Yeah, I think it's exactly what Mike said, that we're part of and you said at the beginning of the show, a knowledge-based ecosystem, a knowledge-based industry that can really create sustainability for the economy in Newfoundland and Labrador.
All right. Any final thoughts from you other two before I let you go?
I have one more thing to say.
Yes, please.
Go and then I'm done. I'll be back next week.
For today.
No. If you are a current or prospective medtech founder and things seem hard or taking too long, the piece of advice here is that it's maybe not a you problem and it's maybe not a your product problem. It just takes time. And you can kind of like psychologically attack yourself on that one and say, what I've built doesn't work. What I'm doing isn't useful. And I think just with a little bit of persistence and time and a stroke of luck sometimes, your product lands where it needs to and it works really well. So it's just it's maybe not you. It's a bigger system around you that is full of variables, and just keep with it.
And if you need any help or advice, come talk to us.
Yeah.
There you go. All right, folks. Thank you very much.
Cool.
I appreciate this. All right, that is it for today's show, everyone. If you've got thoughts for us, call the Signal line and leave a message. 709-576-5260, the Signal at cbc.ca. Thank you now to Mandy Woodland, Stephen Ryan, and Mike Wesolowski. Sorry, Mike. Like I said, folks, the Signal at cbc.ca. Tomorrow on the show, looking ahead to tomorrow, well, the future of education in Newfoundland and Labrador. We've got the co-chairs of the Education Accord. They will be my guests. We are taking your calls. Do you have thoughts on the future of education? Questions about the Accord? Get in touch with us tomorrow. Don't miss it.